Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined today by Dr. Claude Jacob, who is our Metro Health Director, and this is our COVID-19 update for the San Antonio community. We have some good news to report this week. Your work is paying off. According to our weekly progress and warning indicators report, we are in a 100% downward trajectory in the number of cases of COVID-19 being reported. In addition, our hospitalizations and ICU admissions has decreased. Again, these are trends. They're not where we are in terms of the pandemic. We are still in the middle of it. However, the number of people on ventilators has increased when compared to last week. This week, our positivity rate has dropped to 4.9%. Again, we are trending in the right direction. Keep up the great work. While we see improvements in hospitals, our overall health system remains in the upper end of the high stress score. With all of this considered, our risk level remains moderate in the community, but improving. So again, your work is paying off. Please keep masking up regardless of vaccination status. And if you're unsure still about getting vaccinated, I encourage you to consult with your healthcare provider and visit covid19.sanantonio.gov to get answers to your questions. In terms of our case count, today we are reporting 344 new cases of COVID-19. Our 7-day moving average now is 652. This evening that we're reporting. Again, we have lost too many of our loved ones and neighbors throughout this pandemic. Almost everyone in the community knows someone who is lost because of this, and we want to make sure that we keep them in your prayers this evening and continue to do our parts to ensure that we protect those of us around the community. Over in our hospitals, there are 868 patients in area hospitals. There were 73 new admissions in the last 24 hours. 314 people are in the ICU with COVID-19, and 196 are on ventilators. Again, worth noting, 83% of patients in area hospitals are unvaccinated. 22 patients this evening are children. Let me turn it now to Judge Wolff.
Yeah, thanks, Mayor. And it is good to see things going the right way, but we still have a long way to go. I think we had another 70-some-odd patients in the hospital that went to the hospital just in the last day or so. So it's not over yet, but we're going in the right direction. I was really pleased to see Pfizer say that they think they've developed a vaccine for children from 5 to 11 years old. They don't have to use as strong a dose as you do for adults, maybe 1/3. And hopefully that will get approved by the federal FDA. If you look across the nation, now these are children 17 and younger, there's over 30,000 of them in the hospital right now. So they can be impacted by COVID in a very negative way as adults can, and they, of course, pass it right on to other adults also. So that's a positive sign that we'll have a vaccine for them. Just this week, we exceeded the number of deaths from the Great Flu epidemic of 1918. We have 675,000 people now who have died from COVID that we know of. There's certainly probably a lot more than that. And we're still averaging about 2,000 people nationwide that are dying every day. And as we all know, it's the people that, for various reasons, would not get the vaccine, and it's a shame to see them pass away because they chose not to do that. People are really going to the drugstores now to pick up these antigen home test, and if you do have one, they say if you have symptoms and you're taking the home test, antigen is about 80% the effectiveness of a PCR test, and some people may do that antigen test, and then if they are negative, they may want to confirm it by a PCR test. But they're really flying off the drugstore shelves, and which is good. It's good to see that people are doing more to make sure that they do not have COVID, or if they do have it, they know that they need to get it treated. Mayor has said several times before now, University Hospital is extremely low levels for platelets and type O blood too. So if you can donate, there's various ways to do it. Of course, with South Texas, blood and tissue. But if you'd like to donate to the hospital, phone number is 210-358-2812.
Great. Thank you, Judge. And if you go outside, you can feel north wind blowing. We're all excited about that. It's not going to be that cold, but this time around. But it also means that flu season is here. So we want to let you know that flu vaccine is offered at no cost at all Metro Health COVID-19 pop-up clinics. So again, for a list of COVID pop-up clinics where you can also get your flu shot, visit covid19.sanantonio.gov. Finally, to find a testing location for COVID, just visit that website as well, covid19.sanantonio.gov, or you can call the hotline 311 and hit option 8. Please wear a mask, get vaccinated, do it for yourself, do it for your family, and do it for San Antonio. And finally, to get the latest on COVID-19, text COSA.gov to 55000 or go to the website that was on your screen. With that, Dr. Jacob, the judge, and myself are available for questions.
The federal government is pulling monoclonal treatment from some locations, the nearest being Hondo, Texas. Could you give us your thoughts on this and tell us whether you think there might be a threat of taking monoclonal treatment away from Bexar County?
Well, let me just say real quickly, we've had a tremendous demand out there, and that's why these infusions are getting a short supply across the nation. I know as of last week, we had done 4,000 out there. In the previous surge, we did about 3,000, so we're doing a heck of a lot more. Now, people need to realize those infusions cost $2,100. They're paid for by taxpayers, and obviously almost everybody going out there were not vaccinated, as opposed to a shot that costs only $20. So I think there's a nationwide supply, and I think they're beginning to tighten up. 70%, I believe, of all of the infusions have been done in, I think it's 6 different southern states because they simply weren't vaccinated.
Have any of you heard from providers that they're having a tough time getting a hold of monoclonal antibody treatments?
I haven't.
I have not heard that.
No.
Are city immigration services involved with the situation in Del Rio at the border? And if so, do they need any sort of help from the community?
The city's immigration services have not been involved. Again, this is an entirely federal operation, so we've not been called in to assist at the border.
Do you have any idea how many migrants have moved through San Antonio in the last week?
I do not.
I don't either. I talked to Sheriff Salazar just a few minutes ago, and he went with DPS in a helicopter out to Del Rio, and I asked him, does he know of any that were here that were arrested? Of course, he doesn't, but that's not our job to arrest a potential immigrant. If they commit a crime or something, we arrest them, of course, and then if there's an immigration problem, then we notify ICE about it. But this is a federal issue that they have to deal with, and he tells me that they're flying out plane loads and plane loads of them back to Haiti.
Mayor Nirenberg, could you address that enforcement issue for the city?
Say that again, Bruce.
Is the city involved in the detention or arrest of migrants who arrive in San Antonio illegally?
I think the judge said it very well. We do not have jurisdiction in terms of enforcing federal immigration law. We have not. We do not. To the extent that someone is caught committing a crime here that we do have jurisdiction over, then we would get involved. But we don't enforce federal immigration policy.
Have you seen the video of Border Patrol officers on horseback assaulting Haitian migrants? And if you have, can we get your reaction to that video?
I haven't seen the actual video. I've seen clips and coverage of it, and it's horrific. And again, I don't know what kind of explanation could be given to explain that kind of scene, but it isn't something you would expect any human being treated, no matter what the issue.
This is for anyone on the panel. UTSA models show that we're not out of the woods yet. We could even see a winter surge. Is that something that is surprising to y'all, and or what are y'all's thoughts on that?
Thank you for the question. Again, what you're hearing this week, we are cautiously optimistic about what we've seen for 6 straight weeks now, that we've seen a steady decline in our positivity rate. Just a reminder that at its peak this summer, our positivity rate was over 21%. And as of this week, the latest reporting period, we're showing now that it's below 5%. So regarding the winter, again, we don't have a crystal ball on this. We do know that there's a higher rate of transmission with indoor activities. We remain cautiously optimistic. We remind folks of the importance of getting vaccinated. We remind folks of the importance of masking up. So at the end of the day, we'll see where we are. We're staying on message, especially as we look to the holidays, to remind friends and family members of the importance of just at least paying closer attention during the holidays, and we'll continue to report out each week.
We just need to get everybody vaccinated. It still perplexes me. Studies have shown that the Moderna vaccination, that it's 93% effective. The Pfizer is 88 in terms of someone not getting sick enough to have to go in the hospital. The Johnson & Johnson, which is only one shot, it was only at 71%, but that's still high. So if everybody would just get vaccinated, this is a unvaccinated crisis. If people had been vaccinated, we would not be sitting here. We would not be watching people die every day in this community.
And I think to underscore the point, again, 83% of patients in area hospitals are unvaccinated. If you think you're lucky enough to survive that and to avoid being in the hospital or to avoid the worst of it, then you're gambling not just with your life but also with your financial health. And again, we know it's extremely expensive to find yourself staying in a hospital. If you can avoid that with a free COVID shot, why wouldn't you? But we're also hearing, at least anecdotally, that the stays, particularly for those on the severe end of the spectrum, and those, again, are almost primarily all unvaccinated, ICU stays and ventilators are lasting longer for the patients that are stricken with Delta COVID-19.
Director Jacob, I know last week you said you wanted to see more information before you made an assessment about our performance as it relates to Labor Day festivities. What can you say now that you've seen some of that data about how we handled it?
Again, so far so good, but at the end of the day, we feel more comfortable having as complete of a picture as we can muster. So the latest reporting period shows August 22nd to September 5th. We know Labor Day was on Monday, September 6th. So we'll see where we are in our next reporting period. But all that to say that we remain on task, we remain on message, we remain vigilant. And so we appreciate at least the question, but just know that our tagline going through these coming weeks is just remind folks during the holidays especially to be extra careful and to remain vigilant.
I know that the city of El Paso is sort of touting a 75% vaccination rate as a herd immunity threshold. With the Delta variant now, is herd immunity even attainable? Is it something we should still even be talking about?
Right now, apples to apples, again, our vaccination rate of those who are eligible over the age of 12, we're at 71.3%. We continue to at least push as many incentives as possible to remind folks of the importance of getting vaccinated. Regarding herd immunity, just know that the Delta variant has become the game changer. The fact that it's more contagious, that it is impacting the influx of patients that we're seeing in area hospitals. So just know that we're really pushing a message to ask folks, to remind folks to get vaccinated. And we'll talk more about what that threshold looks like. But just know that to date, we are at 71.3% of the eligible population over the age of 12 that is fully vaccinated in San Antonio and Bexar County.
That's all we have tonight. Thank you.